The system of gas exchange in our body is a fundamental part of how animals work. It allows us to take in oxygen required for cellular respiration and expel the carbon dioxide produced by cellular respiration. But before the gas exchange and circulation of oxygen and carbon dioxide through our blood, how do we take in these particles to begin with? This is a process of ventilation, or the movement of air or water through a specialized gas exchange organ, such as the lungs or gills, in our case the lungs. Air enters through the nose and mouth, down the trachea, and into the lungs. However, the process is not always so easy. For people with asthma or lung disorders, things can get a bit more tricky. Let's take a look. Lung disease is a worldwide medical condition which has caused suffering for millions. A common lung disease, asthma, involves the inflammation and constriction of air pathways, making it hard to breathe. Chronic obstructive pulmonary disorder, or COPD, is a group of lung diseases which can cause obstruction of airflow to the lungs. In 2004, the World Health Organization estimated 235 million people affected by asthma and 65 million people by COPD worldwide. For this reason, scientists are working on new advances in treatment of asthma and COPD. Specifically, the innovation of dry powder inhalers, or DPIs, are becoming popular. But how effective are these dry powder inhalers? The next two studies take a closer look.
A DPI allows you to inhale the powdered version of a medicine, which comes in the form of a capsule or blister that is cracked open inside the inhaler. There is no propellant, and instead the medicine is breath actuated. This means that the medicine enters your airway as you inhale. On the other hand, MDI or metered dose inhalers are devices that deliver a measured amount of medicine as a mist that the patient can inhale. It consists of a pressurized canister of medicine in a case with a mouthpiece. You're probably more familiar with these devices, but they are quickly becoming less common with the rise of DPIs. While DPIs were released into the market before MDIs, the current technological advances in DPIs make them the preferred device by asthma patients. In a recent study comparing MDI aspects with DPI features showed a definite preference for DPIs for multiple reasons. Studies used in this analysis were conducted in adult and pediatric patients with asthma to assess the efficacy, safety, and acceptability of either DPI or MDI as inhaled beclomethasone, or BDP, is given through these devices to study groups varying in age and asthma severity who were placed under observation for 2 to 4 weeks during the time of treatment. What do the findings show? First of all, the study showed that DPIs were found to be much more accessible by patients across a broader age range. In response to the question, which inhaler was the easiest to use overall, 67% of all patients chose the DPI, while only 22% chose the MDI, and the remaining 11% had no preference. This can partially be contributed to the ease with which DPIs can be used in comparison to that of MDIs. It is much more difficult to determine whether a full dose of medication was consumed by the patient using an MDI device, and changing the concentration of medicine is often not possible in these cases. Maximum effectiveness can only be achieved with user compliance to instructions on device usage, and the DPIs were simply found to be more user-friendly than the MDI devices. Similarly, patients using current market DPIs reported significantly less irritation and coughing than the MDI users did. Both devices had high ratings in safety and efficacy, but technological advances in device design allowed DPI to have an edge in patient acceptability and efficient consumption of medication.
Now that we know that dry powder inhalers are the way to go, let's take a further look at some advances that have been made in DPIs. These devices assist in delivering aerosols to the lungs through the nasal route. However, a disadvantage to this is the depositional loss of the dosage to other pathways along the way to the lungs. Now, how exactly can this be fixed? The answer is through excipient enhanced growth, or EEG, formulation aerosols. EEG allows an accurate increase in the droplet size of a substance, which without growth would be exhaled. An experiment done to test this had an inhaler deliver ciprofloxacin, and the nose-to-lung delivery was measured using in vitro and computational fluid dynamics, or CFD, methods. The 2.3-343 device, which had growth in the airways, increased the aerosol size to 2.5 to 2.7 and had a depositional of less than 5%, which means that the amount of substance lost in the passage to the lungs was less than 5% of the original amount. The CFD results matched the in vitro ones but had the nasal deposition as less than 10%. The average RMS value of flow rate was measured to be 13.9 lpm, and the amount of ciprofloxacin hydrochloride dose emitted from the 2.3343 N2L device was 67%, as seen in the table. So does this work for people that may have respiratory problems? Of course. The experiment also compared the N2L growth delivery if a patient simultaneously received respiratory support from high-flow nasal cannula, or HFNC therapy. The HFNC device had a 13.4 lpm flow rate through the N2L, and this was almost identical to the measured amount for the N2L system. The overall lung efficiency was 64% of the loaded dose. The CFD model is very accurate in predicting the results after the growth given by EEG formulation aerosols. For N2L delivery, there's a size increase of the aerosol resulting in 2.4 micrometers of the dose leaving the lung chamber. This value is close to the experimentally measured value of 2.5 micrometers. Similarly, the deposition value gotten in the experiment is 2.7, and the same as the in vitro predictions in the CFD model. Check and check. Overall, the conclusion is that the use of an inclined DPI with EEG formulation allows a high efficiency of lung delivery. Further advances to be made for DPIs are pinpointing exact locations of deposition and using antibiotics to figure out real doses for clinical effects and to test out these DPI devices.
So what does this all mean and why does it matter? The two studies affirm that dry powder inhalers are an effective recent advancement in the treatment of asthma and COPD, not only because of their efficiency, but also because of patient acceptability and compliance. Perhaps the introduction of dry powder inhalers is the next breakthrough which will improve lives one breath at a time.